So today we're going to talk about line infections. Well, what's a line? A line is a device that goes in a vein or an artery to infuse a medication. We have peripheral lines that go in the veins that are far away from the heart, and then we can have central lines as well that go into veins and arteries that are closer to the heart. And these devices, of course, are wonderful because they help deliver medications to our body, but of course, any artificial device can cause infection. The most common infection we see with a peripheral line is a local phlebitis. So the line in the vein gets, a clot is formed around the line, and then that clot can become infected, so we can have a local phlebitis. Oftentimes, simply removing the line cures the problem. Sometimes we can put a warm compress on the area, as well as begin a short course of antibiotics. And in the worst case, the surgeons might have to remove the phlebitis surgically if it's large. The central lines, on the other hand, we see those get infected either at the site of entry into the skin or at the tip that's in the bloodstream. If they get infected down at the tip that's in the bloodstream, they can release bacteria into the bloodstream and cause a bacterial infection in the body. And that can be a little more serious. Of course, to treat that, the line has to be removed, the patient has to be started on antibiotics, and we have to look for distal sources of infection. Let's talk about prevention of line infections. Of course, there's protocols in hospitals and in outpatient settings where lines are placed. The peripheral lines are changed on a certain frequency so they don't have time to develop phlebitis. And the central lines, the dressings around them have to be changed frequently, and the nurses and other caregivers that are instilling medications into the line have to do it in a very sterile way so as to prevent bacteria from getting into the line in the first place. Infectious disease doctors oftentimes get involved with line infections when the patients develop bacteria in the bloodstream, which we call bacteremia. We oftentimes get called in those settings when a patient would present with fever and bacteria is isolated from the bloodstream, or if around where the line enters the skin, that area becomes red or drains pus, or a patient develops a phlebitis, which is an inflammation where a peripheral line is placed. I hope you enjoyed the video. If you have any further questions, feel free to call us at 954-776-9992 or visit our website at infectionsmanaged.com.